You know, there was just something so profoundly sad about this young woman.
I guess my first thought is, what is she doing here? Because she just didn't have that look to her.
With mood disorder, bipolar disorder, narcissistic personality disorder. The prison was aware of her mental illnesses because they're the ones who classified her as seriously mentally ill.
If I told you, well, you're depressed, and first you have to get in this cage, and then I'm going to bring the doctor in to talk to you, you'd say that's ridiculous.
The only treatment that you're getting is that mental health professional coming in and saying, are you wanting to kill yourself?
We had inmates that would cut themselves, swallow wires.
But do you feel qualified
to deal with mental health? No, not at all.
Prisoners have no consumer choice. There's really no incentive to please your customers.
This is Matt.
Why didn't somebody help my son? They just look at him like a number. They're not people to them.
I don't care who's at fault. You need to get it done because my clients are dying because you're not doing your jobs.
Yeah, I would just have Miriam and I met. We were in the same jail together. Yeah, this one is from Miriam. She always said she wanted to be a firefighter. Yeah, to be a firefighter. She missed going to the mall. She missed her mom spoiling her, and she would always just talk about how she's gonna take us to Tucson and we're gonna hang out. Oh, she said, I wanted to tell you that I'm going to prison and I'm getting sentenced on June 26th. I missed you and I hope you're doing good. When I first found out, you know, I couldn't stop thinking about her. She was so young. And we never got to go to Tucson.
When I get out, I'm gonna live with my mom. She's gonna let me stay there while I go to school. Because it's only 2 years to become a firefighter. Well, I was reading this book, and then the book it says this man is a firefighter, and he is the important thing is to save people, but the most important thing is that you come out safe. I wouldn't care if I came out safe, but I'm gonna make sure the other person came out safe.
I was doing some reporting on juvenile solitary confinement, and in doing a Google search, stumbled across a news article about Miriam's death. The thing that interested me was, one, she was so young, and there was a letter attached to the article that Corinne Kendrick, who is an attorney at the prison law office, had written on her behalf, indicating that she'd been held in solitary confinement for a long period of time. I wanted to find out what had happened to her, especially given that someone had advocated on her behalf. Miriam came to the US when she was 9 in 2007. She is from Iraq originally.
I spoke to Miriam's mother. She had said Miriam's father was murdered in Iraq, that Miriam and he were incredibly close, and losing her father and then having to flee Iraq because the rest of the family was threatened was very traumatizing to Miriam.
The family was in danger, and eventually they moved to Tucson.
When they got to Tucson, Miriam had a tough time in school, not knowing much English, being bullied by other children.
My school was called El Tabari. All of my friends and family were in Iraq, and I had to leave them behind. I wasn't happy here when I couldn't speak English.
She was tired of being bullied, fell in with a crowd of people who it's believed they were in gangs. She started taking drugs, she started fighting. And then when she was 15, she and her then boyfriend robbed a man at gunpoint, for which she was then sentenced and sent to Perryville.
I met her when she came to the hall, and then we were in one of our classes. I guess my first thought is, what is she doing here? Because she just didn't have that look to her. She had a good attitude, but at the same time, you know, a little bit depressed.
I filed the FOIA in April 2017 to get information about Miriam from the Arizona Department of Corrections. It took a lot of follow-up emails with the department before they actually released this information. They sent me probably about 200 documents, videos, pictures, and a couple of the videos that stood out were the use of force videos. There's a video that was shot on July 10th. She said that she had a rash and had bitten her arm because it was itchy, but she was taken to meet with a nurse who phoned the psychiatrist on duty.
Okay, very well. Continuous watch.
Suicide Watch is a cell. It's not in a medical facility. It is in a detention center, and you are in a cell.
Sometimes when they would try to take her down to watch, she would like fight with them because she didn't want to go. I mean, I don't know why anybody would want to go there, but...
Hey, stop. Hey, stop. Hey, sit down. Sit down. Stop resisting!
Initially, you'll go on continuous watch, and your clothes are taken away from you. Everything's taken away from you. You can't even have a book. You can't have anything to write with. It's just you, and you're in kind of like a smock type. It's kind of like a heavy blanket type smock, something that you can't necessarily finagle to wrap and tie or anything of that nature. So if I'm in the watch cell and I'm just laying down, you're a correctional officer and you're watching me continuously.
You know, if you're gonna get dragged off to a room that has like poop smeared on it on the walls and have to put on a smock that's letting blood on it from people having their period in it, you're not exactly excited to go, so.
You're not interacting with me. We're not having conversation. You're not trying to help me. You're not providing any service to me other than watching me and making sure I do not do anything that's going to harm myself.
She was diagnosed with mood disorder, bipolar disorder, narcissistic personality disorder. She's listed as being prescribed risperidone and benztropine. There's an indication that she has multiple prior prison hospitalizations for suicidality and 15 prior suicide attempts. The prison was aware of her mental illnesses because they're the ones who classified her as seriously mentally ill.
Perryville did what unfortunately happens in a number of badly run prison systems, which is when there are inadequate mental health resources and inadequate mental health programs, persons who are mentally ill tend to be shunted off into isolation units for management and control.
During the time that Miriam was at Perryville, the entire department was basically under scrutiny due to the case Parsons v. Ryan.
Parsons v. Ryan is a class action lawsuit that the ACLU, the Prison Law Office, and some others filed in 2012 because we found horrific deficiencies in medical, mental health, and dental care in the Arizona State prison system.
People were dying. They were dying not just due to suicide, but they were dying because they had different illnesses and they were not being properly treated.
And the case was settled in 2014, and as part of that settlement, the state of Arizona agreed to comply with 103 separate performance measures
These run the gamut, things like people on certain psychotropic medications need to be seen every 30 days, or people that need to see a specialist, it has to be completed within 60 days. So there's all these benchmarks.
So these are basically all the measures that were agreed to in Parsons v. Ryan. And one of those is that a minor who has been classified as being mentally ill should be seen every 30 days by a licensed clinician. It appears from court documents that I got, in fact, there were sporadic visits. Basically, the Department of Corrections was not doing what they were supposed to and what they'd agreed to under Parsons v. Ryan.
And as part of the case, the department monitors their contractor, which is a corporation called Horizon.
Welcome to Horizon TV. Our focus today is on mental illness, which is a very common condition in our society, both inside and outside of corrections.
There are a lot of states that have outsourced healthcare, so including mental health care, to these private prison companies.
The privates claim, and this is their big selling point, that somehow they can do the same job, they can generate a profit, which of course the state doesn't have to do when it's operating healthcare, and they can do all of this more cheaply.
Arizona first passed this one law that said privatize healthcare, but only if it costs less than what we're currently paying for the state employees. And then they put out a request for proposals, an RFP, and nobody bid for it because nobody could do it for less than what the state was spending, because the state wasn't spending very much as it is. A couple of years later, the legislature came back and said, oh, we're gonna amend that prior law. Remember where we said it has to be less? It's okay, it can cost more. And that's exactly the situation they're at. They have a for-profit company that is providing the health care, and it costs a lot more than when the government was doing it.
There are the incentives that the contract builds in and creates for the private prison provider. So in this case, it's basically a fixed dollar amount contract. It's $16 and change per prisoner, and the contract assumes 34,000 prisoners. So it's basically, this is how much we're giving you. And the more money you spend on providing health care, the less profit you make. So this creates a powerful, indeed overwhelming, incentive to deny care.
I got the job at Horizon when I moved back down here from Texas. I'm a nurse. I do pretty much anything and everything. Taking care of patients, passing medications, administering injections.
My job is to see everyone 15 minutes, 30 minutes. It's a check-in more or less because there's not enough time to actually do any type of therapy. Sometimes I would see upwards of 25 people in a day who were on the mental health caseload.
We had inmates that would cut themselves, swallow wires, bang their heads.
But do you feel qualified to be making
To deal with mental health? No, not at all. I mean, I really don't, not in those situations.
So how did you end up doing that?
We had to. We were the only personnel there at night.
The only treatment that you're getting from a mental health perspective is that mental health professional coming in and saying, are you wanting to kill yourself? I don't have the resources to sit with you to understand why you were having those thoughts.
Did you at some point say, I need, and what happened?
There's no resources. There's no money for that. Go on the internet. You can find it. You're resourceful. You're a doctor. You got this.
Oh yeah, there was emails sent back and forth between not only myself but other nurses to management talking about how short we were and how unsafe it was at this point. This was sent November 14th, 2018. It says, I'm writing to let you know there are multiple nurses here that are feeling overwhelmed, underappreciated, and overworked. We are trying our best to be understanding of the situation, but then we hear that we need to keep doing our 150% and then some because we're not doing enough. We're sacrificing our breaks, our lunches to try to meet all the demands. Help! Literally, that was the subject line, in need of help.
I felt that my license was at risk. I felt that I didn't have the autonomy that was needed as a licensed psychologist to be able to run mental health the way that it needed to be run.
The lack of support, I guess, the lack of resources is what made it a lot worse.
So there are probably 3 major corporations, Wexford, Centurion, and Horizon.
The privatization of prison health care in Arizona took effect on July 1st, 2012. And the first contractor that had the contract was Wexford.
Wexford was there for less than a year, and when they left, they terminated the contract because they said Arizona Department of Corrections had misrepresented how severe the problems were.
And early in 2013, the contract was assumed by Horizon. So Horizon has had the contract now for over 6 years, during which time they have been chronically unable to comply with a large number of the performance measures. So Horizon is now leaving, and on July 1st, 2019, Centurion is taking over.
And this is similar to what has happened in a number of different states, where one company will be there, one company leaves, another company comes in. And so this has happened in Florida, in New Mexico, in Maryland. I think pretty much most states that have private prison healthcare companies, there has been this change.
The problem is when you have only 3 players that it does become kind of a revolving door among those 3 players, or a game of musical chairs, and all too often things don't really change in a meaningful way.
This is Matt. This was the picture. That's the last time I seen him. And then behind you is a degree, his president's list, his dean's list, the letter that he wrote me when he sent it to me. Dear Mama, I had to work really hard to get this. I hope you're proud of your son. I'm trying my best to get home ASAP. I love you and miss you. Love your son, Matt. P.S. Tell Dad I need some cash when he can. This degree should be worth $1 or $2. He did tell me that he tried suicide before.
Matt Holmes told a psychiatrist that he wanted to be dead. He was placed on mental health observation. 2 days later, he was released from mental health observation without any kind of assessment, and he was sent back to segregation. And just a few hours later was dead.
So the link between Matt's story and Miriam's is that they were both held in isolation. They had both tried to harm themselves before, but the isolation was different. In Miriam's case, she was isolated both because she did things, so she refused to obey orders, or she did something and she was isolated for disciplinary reasons, and then she was also isolated by being put in a suicide watch cell. Matt was placed in segregation, and segregation is not a suicide watch. It's actually for disciplinary reasons. So there isn't anybody watching, there isn't anybody really monitoring your mental health or offering any sort of assistance. And the issue in Alabama is that a lot of people who have mental illnesses have been placed in segregation.
What is making the prisoner despondent and suicidal is the isolation. And very few mental health providers have the power or exercise the power to remove people from isolation. If I told you, well, you're depressed and I want to help you and here's the circumstance under which you're going to get help. First, you have to get in this cage, and then I'm going to bring the doctor in to talk to you. You'd say that's ridiculous.
And when you couple that with the Alabama Department of Corrections' inability to identify people with mental illness, identify people who are vulnerable to the harms of segregation, you end up with this shocking level of suicide that we've seen over the last year and a half. Nearly all of them were in segregation or some unit that functions like segregation.
Why didn't somebody help my son? These people that work in these places, it's a job. They just look at them like a number. They're not people to them.
I think one of the really big problems is that the whole business model is not based on the value of care that's being provided.
The idea that companies that provide bad service will eventually go out of business don't really operate in the prison sector, and that's because the ultimate consumer of the service is the prisoner, and prisoners have no consumer choice. It's not as if the prisoner can say, wow, that healthcare at this prison is really terrible. I'm going to go down the road to this other prison and see if it's better there. And so there's really no incentive to please your customers. For-profit corporations that are pretty much insulated from the usual consequences of bad corporate behavior. And that's a problem that cuts across any kind of privatization in the prison and jail sector.
Who, in your opinion, is at fault here?
My personal opinion, and this would often happen when we were in court, was the ADC people would say, oh, it's Corizon's fault, and then somebody from Corizon would say, oh no, it's ADC. And my position on it is, I don't care who's at fault, but both of you are supposed to be doing it, and you need to get it done because my clients are dying because you're not doing your jobs. 95% of the people who are in prisons come back to our communities, and we want them to come back healthier in body and in mind. What we've done as a society is just to criminalize mental illness, and prisons in our society are basically the dumping grounds for all of the failures of society and programs, and Miriam's a great example of that.